So hello everyone, so we're going to continue our videos on phlebotomy. In our previous video we talked about some of the safety aspects to consider. So we talked about making sure that we've introduced ourselves to our patient, we have said who we are, why we're there, explained the procedure, gained consent, and more importantly made sure that we've identified the patient correctly using our blood form, so we have the correct patient. We've got our sharps been with us, we've performed hand hygiene, and we're going to perform all the other infection prevention things that we need to. And for this video, we're going to focus on the preparation for taking blood. So if we're going to prepare to take blood, there's several things to consider. One of the things is to make sure that our patient is comfortable. So Tina, hi.
Hi.
So Tina is on a bed or a trolley, which is a thing to consider because we want to make sure that the patient is comfortable. This isn't particularly the nicest procedure to happen, and so it's important to make sure that your patient is your focus and that they are in as comfortable position as they can be. Sometimes that won't be possible if it's an emergency situation, but if it isn't an emergency situation, which most of the time when you're a student it shouldn't be, taking those steps to make sure your patient is comfortable is really important. It'll make your patient more relaxed, it'll make you relaxed, it won't make you feel pressured to take the blood quickly, and also if you do happen to miss a vein, which is possible, then your patient will be more inclined to allow you to have another go if they've been in a comfortable position or felt looked after. The position, although it is comfortable, it needs to allow the patient to be able to put their arm out and have their arm supported on a folded up pillow. We don't want the arm to be bent. We want the arm to be as straight as possible. So it might take a few times just to make sure the pillow is under the crook arm so the pillow is nice and straight. Or if the patient is too high, you might lower them down a little bit so their arm is nice and straight so that we can make sure we can access the area that we want to. If we are going to be taking blood from the patient's arm, we want to aim for the antecubital fossa, which is just here, on either side, or distal to that, so from here downwards. We want to focus on this area because it's got some really good robust veins that are relatively close to the surface, and there should be three sort of choices there. When we are looking at the arm, before we decide on which arm to look at, we need to ask our patient if they would mind us using this arm. Is there any medical reason why not to use this arm? And so, Tina, what medical reasons are there not to use this arm?
So if a patient's had lymph node clearance because of breast cancer.
So we definitely don't want to take blood from those arms, so we need to ask that patient that question.
If a patient's had AV fistula, which is something that a patient has formed for dialysis long term.
You can identify those as looking, we might see a small scar if it's newly created. We might see a raised bumpy area which looks like a good vein but it's actually a fistula. But the real key to identifying a fistula is if we feel it, you should be able to feel a pulsing buzz, which is the turbulence of the blood going through the fistula.
A lot of patients have wristbands on anyway, don't
they?
And then the third arm is the patient that's had a stroke that's been left with a hemiplegia.
Yeah, so we don't want to take blood from that arm because although there's nothing wrong with the veins, they won't be able to tell us if we're doing something wrong and we're hitting the wrong part, so we want to be mindful of that. There's all the other normal things as well. If someone has a cannula and they're receiving an infusion, we don't want to take blood out of that arm because it will dilute the sample, and like broken arms and like pus and burns, we don't want to be sticking needles through those, so don't do that. Okay, so once we've decided on the arm and we've checked with the patient, we're all happy to go, we then want to think about trying to find the correct vein within the arm. So like I said, we're going to go for the ACF. So you can do a visual inspection first to make sure everything is clear, and then we might want to put a tourniquet on the patient to try and close off the veins to the arm but leave the arteries open. The idea of the tourniquet is that we want to increase the pressure within the veins so that they will dilate, they will get slightly bigger, they'll be more visual, we'll be able to feel them better, but the reason we can feel better is because it will increase the pressure within the veins. And the reason we want to increase the pressure in the veins is so that when we insert a needle, the pressure will resist the needle, so the vein will keep its shape as we insert it into the vein and maintain its shape as we take the blood out of it. If we don't have that increased pressure within the vein, then it will just flatten as we put the needle into it and we won't get a needle into it. So, if I was going to put a tourniquet on a patient, we're going to use these disposable tourniquets, which are a little bit rubbery.
Wow.
Sorry, and they can pinch a bit if you don't put it on correctly. So we're just going to show you a technique to try and get that on correctly. So with Tina's arm, what I would do is make sure I ask her to raise her arm slightly. I'd hold the tourniquet like this, so it's over my hand and hanging down the back, and I would hold the end of it between my thumb and my forefinger. I would then bring the tourniquet underneath the arm and hold it. If it was a wider arm, you'd probably need more tourniquet. If it's a thinner arm, you need less. And I would stretch it out before I wrap it round, which is an important step. And then maintain that stretch as I wrap the tourniquet round. Keep my fingers underneath the clasp, and then let it go so it's connected to her there. So now the tourniquet is on. You want to make sure that it's tight enough so the patient can tolerate it, it's not causing pain, but it is tight enough to do its job. And that's different person to person, so I can't tell you an exact tightness of the tourniquet. So and then once I put the tourniquet on, I then can give the veins a little bit of time to build up. You might ask the patient to hang their arm down, you might ask them to tense and relax their hand to build up the pressure, and then I want to now start feeling my veins. So I'm going to now palpate the veins in Tina's arm, and I can feel that she's got a vein here and a really, really good bouncy vein here. Now what I want to do is, as I'm feeling this vein, I want to feel the direction which it goes, which is this direction. So I'm going to position myself so I'm looking dead onto the vein. I'm then going to feel, as I palpate it, I'm going to work out the depth. If I can just palpate it gently, it's quite a shallow vein, but if I have to palpate it really hard and push really deeply, it's a deep vein, so I know how far to put in the needle. I also want to see if it's wiggly or not, and then I'm going to stretch the skin to feel the vein, to see if it moves when I actually stretch the skin and form some skin traction, which we'll talk about later. Okay, now I've got the idea of where the vein is, I can take the tourniquet off the patient and let the blood flow back into their arm now so they can feel a bit more comfortable. And then I can prepare my tray and do all the things that I want to get ready to actually take the blood. When we're palpating a vein, there is the best vein in the world is one that we can see, because we can see where it is, and feel, because we know we've got the high pressure in it. The next best vein is one that we can't see, so we can't see it from the surface, but when we push, we can actually palpate it. So we know we've got a really good quality vein there, we just need to be able to be more accurate where we go with the needle. The vein which you wouldn't bother trying is one that you can see, but can't feel, and Tina's got a really good example of that here. A really good vein that you can see, but actually when you push it, you can't feel anything, and that's a vein that it's got not a lot of pressure in it. So when you're actually palpating, what you might find is that although you are going to look and palpate, it might be a good idea to actually turn your head, because it's all about the feel of the vein and how the vein actually feels when it palpates. And sometimes your eyes can fool you into thinking a vein is better than the other one, but actually that's just the look. Really what it is, it's important to feel the vein and really bounce it and palpate it. When we're bouncing it, what you're doing is actually compressing the vein so you can squash the blood out of it. But when you lift your finger off, you can feel it re-inflate, and that's when you know you've got a lot of pressure in the vein. Okay, is there anything else I've forgotten?
No, that's perfect.
Okay, so that's it about preparation. Our next video, we're going to talk about quality of blood samples. Thank you very much.